Hi, this is Dr. Doreste with the Cranial Release at cranialrelease.com. I wanted to touch on a few different topics that I normally don't talk about. And I've been getting some emails from practitioners asking me about things like, we've watched your videos, we know about cranial release, we know how powerful it is, we know what a great tool it is to have in the toolbox with patients. Not just complicated patients, but sort of everyday patients that are looking for optimizing health, more relaxation, sleeping better, feeling better, functioning better, performing better in every aspect. And what I wanted to talk about today was something a little different. Just touch the screen up a bit. There we go. And really, why is CRT good for the practitioner from a practical standpoint, from a practice standpoint? So I want to do a few different types of lectures, but the first one today is just going to be in general to say that if you're going into an office every day and it's kind of a drudge and a boring experience, and I know I've been there. I graduated in 1985. I know what it's like to go into the office and deal with. It seems always funny to me that you can look at your book of all your patients coming in and you're focusing on the one patient that's going to break your chops, the one that's never satisfied, the one that you should probably refer out to the practitioner across the street or something. So I know the mental grind of practice. I know the physical grind of practice. I know the financial grind of practice. Rent, staff, expenses, waiting for money to come in. I understand that. I've been there. I'm with you. I get it. So 20 years ago, when I started the Cranial Release Technique and started teaching this work, one of the things that I wanted to do is share what it did for my practice, standard, osseous type adjusting, all different patients from all different backgrounds, transition to a CRT and chiropractic practice where everyone would get an adjustment and a CRT. And when I mastered the cranial release, when I really got it right, when I became a black belt, I shifted virtually from everything I was doing to a solo only CRT practice. That may not make sense for you. That may not work for you. That's completely fine. I was with the patient only a minute or two or three anyway. So the fact that I went from a minute or two or three with everything I was doing to a minute or two or three with just CRT, which takes a minute. I mean, I literally would come in, hi Mary, check their legs, one leg short, one leg tight, do the cranial release, come back, recheck, better, see you on your next visit. That's virtually what I did with everybody. So the only way you get to that, obviously, is education. They needed to know what I was doing, why I was doing it, and why it made sense for them to go into their pocket to pay for that. So we'll talk about that maybe in another video down the road, but it really streamlined my practice. It reduced my stress. It made my day-to-day practice fun again. Fun again because, first of all, you never know what's going to come in, and you never know what you're going to be able to help, and you're always excited about giving it your best. And that's why I always did practice before. But with CRT, with Cranial Release Technique, my confidence went through the roof. As a matter of fact, I remember the day sitting in my office after hours. It was like a Wednesday night, and I was helping so many people and so many kids, in particular a group of children. They were all disabled, mostly cerebral palsy, but all sorts of terrible illnesses. I got involved with a group of children, parents with children with all sorts of disabilities, and I lectured to them, and I said, listen, I want to really put this to the test. I'll give you all 10 visits. Come in once a week for 10 weeks. Let's see what happens. And they brought their kids. And I saw things that I never would have seen before because this group had access to all sorts of children with every kind of horrible, imaginable birth defects, cerebral palsy, brain deformities. It's just, it would make you cry. It made me cry back then, really. And as I was seeing these kids and they were improving, I remember one night sitting in my office, everyone had gone, staff had gone, was getting ready to leave. And it just hit me that I have something that can touch people at such a deep level that really everybody, it clicked in my head that everybody under any circumstance would be better off with regular CRT care, regular cranial release care, than without. And I don't know what happened, but the next day, all hell broke loose. And people just started coming out of the woodwork, and they weren't coming in with neck pain and back pain. It was Parkinson's, it was ALS, it was dementias, it was all sorts of neurological trouble, all sorts of hormonal imbalance, endocrine trouble, all sorts of skin things. I never advertised. I don't even know how they found me. It's something that happened in me that went out. I don't know the explanation. I can only guess, and it's all happened to all of us. And these people just came and they found me. And I never advertised. I had one line in the Yellow Pages, back for those of you who remember the Yellow Pages, long time ago. I had my name and my phone number in the Yellow Pages in Flushing, Queens. That's where I practiced. And I don't know what happened, but I know what happened. And what happened was I knew that 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 whoever walked in that door with whatever diagnosis, name, whatever it happened to be, I knew that if I could get them on that table for 1 minute and do my thing, cranial release technique, their body would function better, period. What happened after that is between them and their body. So it really brought the fun, the excitement, the passion back into practice. So cranialrelease.com is the website. There's a button there called Online Training Program for those of you that want to learn more about how do you actually learn this technique and how do you put this into practice. And I can tell you, over the last 4 or 5 years that we've had this training out there, people are doing it. They've never met me physically, only by a phone call or through the computer, and they are getting it right. Everything that I expect to change is changing for them. They're seeing pre and post changes. They're getting it all from the modular program that we have online. So cranialrelease.com is the website. Click on the online training program. I have some other videos that are coming up in the near future, so feel free to share this. Hope you like it. Hope you subscribe to the Cranial Release Technique YouTube channel, and I look forward to meeting you down the road. This is Dr. Doreste saying adios, my friends. Keep up the good work. Talk to you soon. Goodbye.